Now, the increasing numbers had Premier Doug Ford on the defensive today. He's standing by his new pandemic framework, despite the wide criticism it has received from epidemiologists.
I'm just not going to get into one doctor versus the other, but I have to listen to the docs that are around our health table, which are the best in the country.
Epidemiologists have been raising alarm bells that the new framework's benchmarks are set too high for restrictions to kick in. The Premier acknowledges he's trying to find the balance between the pandemic and the economy.
I think it'd be worse disaster if we just shut everything down.
Peel is the only region in the red zone. That's the last zone before full-on lockdown. Its medical officer of health has added new restrictions above the provincial guidelines, and Toronto is considering whether to do the same when it comes out of a modified stage 2 at the end of the week. Today, the province's top doctor said if the public followed all of the guidelines, the pandemic could be beaten back.
We can bring it down. It's within our grasp. We did it before, and I think we can do it, Rob. But that's aspirational, I know. And but the more the people do it, the more we can try and get a handle and maybe get back to case contact. If we can't get down to green, can we get down to yellow and get our case contact people back into a level where they can cordon it off and hold it back at that stage?
Dr. Williams blames COVID fatigue for the increasing cases, but warns he doesn't want to have to go back into lockdown. He also said the 28-day closure of gyms and indoor dining in hot zones like Toronto and Peel didn't have as much impact as he would have liked. He blames people's habits.